I want to thank you very much for this invitation on behalf of myself and the team that developed DengueChat. I'm here with Dr. Josefina Coloma. We're both from the University of California at Berkeley, and I also direct the Social Apps Lab at Berkeley. Let me just begin by saying that this presentation is based on a paper of the same title that is in page proofs and will appear early next year in the American Journal of Tropical Medicine and Hygiene. So, you know, as we know, the mosquito Aedes aegypti transmits arboviral diseases at extraordinary rates, and dengue alone affects perhaps 50 to 100 million people each year, with over 3 billion at risk globally, and that results in an extraordinary economic burden. And this transmission indicates that current approaches to prevention are simply inadequate. And it calls for a paradigm shift from one that largely promotes vertical chemical-based control and vaccine development to one that also concentrates on eliminating the mosquito through actions by the communities it plagues. So we've developed a new platform called DengueChat, which is available at denguechat.org, to advance community interventions in arbovirus vector control. It is an interactive social and software platform combining open source digital communication technologies with face-to-face assemblies. Using DengueChat, we conducted a 19-month pilot study in 5 neighborhoods in Managua, in Nicaragua, and the results were remarkable. Now, given the massive failures in dengue prevention, it's encouraging that the World Health Organization and the Pan American Health Organization recognize the need for a paradigm shift and advocate that the most sustainable approach to curb arboviral disease is to develop integrated vector control strategies. And these include initiatives that focus on, as Marco was just telling us, on the reproductive modification of mosquitoes, on engaging municipalities for improved environmental management, and more important, we think, incorporating community mobilization as a key component. In practice, however, despite some early success strategies, community interventions based on how residents live with mosquitoes have received much less attention and investment in the last decade. Now, research also suggests that new digital communication technologies involving residents could provide significant opportunities to reinvent arbovirus control. Yet to date, these technologies overwhelmingly focus on mapping and reporting. And while they are certainly fundamental in any integrated approach, there is little to no evidence that maps by themselves motivate people to take action that reduces dengue risk. As a result, the proposed integration of community engagement in vector control strategies has not yet materialized at scale, and residents do not participate systematically in risk reduction. So precisely to advance community engagement in preventing arboviral diseases, the Social Apps Lab and the School of Public Health at Berkeley have developed a new resource. All right, so we developed this new resource called DengueChat. And DengueChat is an interactive social and software platform designed to motivate residents both to identify and to eliminate mosquito breeding sites. And in collaboration with the Sustainable Sciences Institute in Nicaragua, we launched DengueChat as a pilot study in Managua from 2014 to 16. Since then, several of the intervention neighborhoods in Managua continue to use DengueChat to systematically reduce dengue infestation without any external support. In addition, its use for dengue control has expanded to Asunción in Paraguay and for Zika control in Nicaragua in 2017 to 2019. The fundamental premise of DengueChat is threefold. First, reducing entomological indices through sustained community engagement results in significant reduction in arbovirus risk at neighborhood levels. Second, communities affected by arboviral diseases are the best sources of information about positive and potential mosquito oviposition sites, and therefore the best agents for their elimination. And third, using the software in combination with face-to-face organization significantly enhances community mobilization to eliminate mosquitoes. Now, these three components together constitute an initiative in which residents using DengueChat become essential participants in data collection, analysis, and action. Moreover, DengueChat considers that residents collectively own the data they collect. It approaches arboviral vector control as a problem of social mobilization and collaborative deliberation, in which the challenge is to motivate or is to translate residents' knowledge of their neighborhoods into specific data of vector control as a means to motivate them to act. The question is always motivation. Now, implementing this approach, we conducted this 19-month pilot study of DengueChat in Managua from October 2014 to May 2016 within the existing social framework of a community-based volunteer brigades called the Brigades for Health and Life. And the pilot established a baseline entomological assessment prior to DengueChat's deployment in 5 intervention neighborhoods and 5 control neighborhoods without the intervention, and subsequent entomological assessments measured impact. Now, let me just say, before I go through the slides, that DengueChat platform is both socialware and software. And here the term platform emphasizes the construction of both a structure and an opportunity, as in a platform for public discussion, that incorporates multiple resources for specific purposes. We coined the term socialware to emphasize that DengueChat is based on a social model of a particular type and intended for a particular purpose, namely to organize participation of residents in arbovirus vector control. Now, in constructing DengueChat, we developed 5 components to guide the articulation of socialware and software. One is that we developed a social model of community organization. The second is we developed an intervention plan. The third is a software application that articulates the social model and the intervention plan. And fourth is a commitment to collaborating with residents in research, pedagogy, and development. And the fifth, is a close attention to the politics of information, because as we know, dengue, Zika, chikungunya are extremely politicized. The software consists of a website, a mobile app, an application programming interface, and a database layer. Let's see. It features 2 sides. One, DengueChat community engages organized residential groups with the aim of educating and mobilizing community residents in mosquito vector control, and it has familiar social network characteristics, including specific feedback to encourage social behavior change for vector control. The other side, DengueChat data, stores and organizes the wealth of data that residents collect, and it keeps a detailed registry, for example, of neighborhoods, house visits, and inspections, and the status of individual breeding sites identified in DengueChat community. And it offers complex search functions with spatial and temporal parameters for inquiries and reports. Now, these 2 sides interact to produce the software workflow. And here you see the stages of step 1, identification, step 2, elimination and verification, step 3, community reporting and socialization, step 4, data organization and storage, and step 5, data analysis and visualization, all occurring around house visits, which I'll describe in a moment. The foremost element of the social model, and this is important, I think, to emphasize, is the determination of a form of assembly making among residents. Assembly making among residents capable of articulating the direct deliberation of specific variables about the evidence of mosquito infestation and prevention activity. Examples of such assemblies include local brigades, youth clubs, social or school groups, neighborhood associations, religious congregations, and sport teams. Thus, the implementation of DengueChat requires an ethnographic knowledge of the communities that intend to use it, focused on social organization, political structure, and cultural values. You can't just parachute in an app and expect it to work. A key element of the social model of DengueChat is talk, chatting, conversing, socializing, reporting about dengue, Zika, or chikungunya, or whatever is at hand, and its mosquitoes among all who participate. And this ongoing dialogue occurs both online and off. Thus, DengueChat emphasizes talking with residents in their homes about the life cycle of Aedes aegypti, of which most know very little, to establish the link between water, refuse management, and vectors. It also emphasizes online blog posting. These different kinds of on and offline talk constitute opportunities for participants to act on speech, formulated within, broadcast from, and publicly visible on a platform dedicated to arbovirus disease protection. Not Facebook, generic media, but on a specific platform dedicated to arbovirus disease prevention. Naming the platform DengueChat was one of the first collaborative contributions of the Nicaraguan participants. In terms of study design, in Managua, we selected 5 intervention neighborhoods of low socioeconomic indicators that were heavily affected by dengue, chikungunya, and later Zika, and 5 matching control neighborhoods. And the key selection criteria was that the neighborhoods actively sustain brigades of health and life, which are a legacy of the Sandinista political mobilization in the 70s, and today decentralized components of the national government's health system. Each intervention neighborhood has its own a resident DengueChat volunteer brigade, led by a facilitator hired by the project who invited community residents to join. The project supplied basic mobile phones for each brigade member, an Android-enabled mobile phone for each facilitator, a tablet and smartphone for the project coordinator, and placed 1 desktop computer and printer per neighborhood in the home of each facilitator as a kind of internet cafe for community use. We deployed DengueChat in the intervention neighborhoods for a full epidemic year, including 2 rainy and 2 dry seasons. Now, DengueChat activities focused on household visits initiated with an evidence-based dialogue between brigadistas and residents, centered around the mosquito life cycle, and followed by identification of key breeding sites inside and outside the home. Each brigade took responsibility for a set of approximately 120 houses in the neighborhood, completed an inspection of each home in search of water containers and receptacles, taught residents how to identify positive and potential breeding sites and how to eliminate them, and revisited homes weekly or bi-weekly to continue the dialogue and to determine if residents had incorporated specific practices aimed at removing and preventing larval habitats. Brigade members were deployed in pairs, assigned specific houses in a square block, and instructed to follow detailed inspection protocol during each visit. Their objective was to accompany residents in the process of inspecting water containers for the presence of immature forms of Aedes aegypti, especially pupa, water storage containers, wash basins, animal feeding dishes, plastic containers, and plant pots were the main focus of their observation, especially the ubiquitous and often uncovered 54-gallon barrels that store drinking water and abandoned tires. Now, the brigadistas also demonstrated specific control actions to protect water containers and best practices to control or remove other sources of standing water. The protocol called for taking a photo of containers before and after an intervention action to eliminate it, and then taking follow-up photos on a subsequent visit. This set of before and after photos constitutes a verification step. Brigade members marked and noted each principal container inspected with a unique identifier, thus creating a historical registry that could be followed over time, giving an extraordinary historical depth to the project. During subsequent visits, brigadistas checked each labeled container and annotated its status. Brigadistas made their annotations of various data points on a one-page house visit form, a visit registry that we developed based on local knowledge. We developed this paper form because residents did not have smartphones and Wi-Fi to work with in the field. We have subsequently developed a mobile version for the project in Asunción, Paraguay, where Wi-Fi was available. The brigadistas earned online points for each visit and for actions taken by residents, which were automatically added to their DengueChat profile. They earned additional points when homes remained free of positive and potential breeding sites for 2 consecutive months of brigade inspection, achieving what we call greenhouse status. At the end of each inspection day, each brigade returned to its facilitator's home or community center, where it held a socialization meeting, a kind of horizontal dialogue to discuss the day's work. And volunteers manually uploaded the form data that they collected and the photographs to a desktop computer, and then through a batch upload to the DengueChat website, a kind of vertical dialogue. Data uploads were doubly checked by brigade facilitators and later audited by the project coordinators for accuracy. Uploading distributes the data to the various pages of the website, and I'm just going to run through a number of the pages to give you an idea And here's a city page in which you see photos, blogging. The teams are on the left. The greenhouses are represented on the right, and you see the ranking of those who have the most greenhouses. Again, you see the blogs. If you look at them, you realize that people are extremely enthusiastic about the blogs. And they uploaded photographs of the house visits, but also presentations that were made in the community and eventually in the Department of Health in the city of Managua. Here you have a before and after page, for example, that shows the various statuses of the identified breeding site. This is a profile page that shows how many points Alicia has made, the number of eliminations she's achieved, and greenhouses. This is I'll come to this page later, but this is a page that shows the results of the brigade's efforts in terms of a statistical representation of risk in the neighborhood, another representation of the efficacy of their work in the neighborhood, user uptake, the number of greenhouses. This is interesting because this neighborhood has serious trash problem, and you see that here immediately in terms of the progress report that shows that only 60 out of 257 homes have achieved, or 23% have achieved green status. And here you have the dengue data side of the site, in which you can search for individual homes, which are all coded, of course, and get a longitudinal sense of, and a spatial sense of how they're doing. And here you have a year's worth of investigations into one single home, showing you the kinds of the findings, and it's easy to spot the recidivism when one site has gone back to being potential or even positive. Again, different kinds of correlations that are made, the use of heat maps and the like, user growth and activity, various measures of uptake of the app. All right. So we did 4 entomological surveys, 1 at baseline and 3 for monitoring impact and development, and they were conducted by professional entomologists trained by the Ministry of Health. Each survey included approximately 100 houses per neighborhood, calculating the classic Breteau container house, pupa per household, and pupa per container indices, among other values. We measured the effect of using DengueChat at 18 months after the initiation of activities, and we estimated the relative risk reduction for the intervention group as compared to the reference group for all entomological indices calculated from larval and pupal counts. We performed 2 statistical tests to estimate the effect of DengueChat at the household level, accounting for neighborhood. First, we performed a cluster T test to determine the difference in household index positivity between intervention and control, with the neighborhood as the unit of analysis. And second, we performed a clustered permutation test to evaluate the effect of the intervention on household positivity, we accounted for variables previously identified to independently affect household entomological status, such as the number of houses evaluated in each neighborhood, water access, chemical treatment, and community organization. With regard to results, during the 19 months of deployment, the pilot study reached approximately 4,000 residents in 5 neighborhoods and monitored regularly 3,200 water barrels, hundreds of tires, and thousands of other containers during 7,300 house visits. The development of the platform, DengueChat, both its social and software, provoked and responded to 4 kinds of considerations among participants: the socialization of evidence, motivation, collaborative design, and the value of using software for all 3. We used the SEPA concept of socialization of evidence for participatory action to emphasize the importance of evidence-based discussions to motivate residents to take actions of vector control. And these discussions consisted of various forms of chat about the evidence of mosquito infestation that the brigadistas find, and DengueChat added an online socialization of evidence to SEPA's traditional in-person assembly. Other forms of on and offline socialization were also important. They included discussions among facilitators and brigadistas about the science of arboviral disease and control practices, as well as the informatics of the software platform and its management of data. Both occurred in the assemblies and in the blog posts, and both the science and the informatics held the attention and commitment of the adolescent brigadistas, male and female. We found that these on and offline socializations of evidence gave residents confidence to learn about arbovirus disease and fight the mosquito with particular actions. And this realization transformed them from victims of disease into proud agents of prevention who could achieve source reduction with their own resources. Additionally, DengueChat employed a number of socialization strategies to motivate residents that are specific to the software and demonstrate its merits. A crucial one is to display the results of evidence efforts as quickly and directly as possible. And this only the software can do. Thus, the DengueChat website shows this return on investment, you might call it, by providing easy to interpret graphic representations of infection risk in a neighborhood based on the number of houses with positive red and potential yellow breeding sites, and the number of greenhouses without either for over 2 consecutive months. As the data are uploaded in real time, DengueChat generates 2 kinds of graphic risk analysis. Change in risk over time in your neighborhood for dengue, Zika, and chikungunya, and progress, as you see here. These real-time website assessments of risk became the focus of considerable community interest and conversation as residents turned to them to demonstrate the efficacy of their efforts. Now, the software promoted 2 additional strategies to motivate participation: certain kinds of gamification and internet recognition. And we found both to be very effective, especially among younger participants. Opportunities to earn fame as a dengue warrior or mosquito killer are internal to the website and occur through 3 features: the blog posts, the greenhouses, and individual profiles. And participants of all ages use them enthusiastically. We found a strong sense of competition among the participants to win points, and that this competition increased not only their motivation, but also their proficiency of participation. Brigadistas also developed an unexpected aspect of the software. They used the tabulations of greenhouses to make comparisons between neighborhoods, and they also notified local officials about problems in the intervention neighborhoods that the DengueChat data had pinpointed. Unexpectedly, the municipality responded with a number of interventions in one neighborhood that I mentioned earlier that was having trouble, such as trash collection, piped water, and fumigation. Attributed by residents to DengueChat, this response was unprecedented. Now, our pilot study demonstrated the great merit of combining software and socialware for effective community-based entomology. While building on the accomplishments of earlier studies, this DengueChat combination achieved reductions in dengue risk significantly greater than traditional methods of face-to-face community engagement and education. Adding the software is clearly crucial to the production of these results, precisely because it vastly increases possibilities and scale for key aspects of community-based vector control, namely mobilization, pedagogy, sustainability, and integration with other prevention strategies, and especially because its technology engages and promotes young residents who are vital to all of these aspects. The software also enabled a vast expansion of the project's pedagogical component, building on the enthusiasm and aptitude of youth for digital technology. There is little doubt that the software technology increases the sustainability of DengueChat as an initiative in vector control because it improves the chances of recruiting a new cohort of young people as older participants cycle out. So let me discuss the entomological impact to conclude. The results of the seasonal entomological surveys show that neighborhoods where DengueChat was deployed had reductions in all entomological indices, in all time points measured with respect to the matched neighborhoods. We measured the effect of the intervention with DengueChat between March 2015 and March 2016 and found significant reductions in the productivity of containers used as breeding sites by Aedes aegypti. We used classical entomological surveys conducted in approximately 100 households per neighborhood to determine total larval and pupal containers, about a total of 818 houses. Larval and pupal counts had significant reductions during the 19 months of the pilot study from baseline levels in the October rainy season to exit levels in March, the dry season, in both the intervention and the control neighborhoods as expected, going from rainy to dry. The reduction was greater in the DengueChat neighborhoods, 95%, than in the control neighborhoods, 86%. However, a remarkable change occurred during the 12 months between March 2015, the onset of the dry season, and March 2016. During this period, larval plus pupal indices were dramatically reduced by 44% in the DengueChat neighborhoods, whereas the control neighborhoods had an increase of 507%. 44 versus 5, for a reduction of 44% versus an increase of 507%. To determine the significance of these observations, we estimated relative risk reduction for the intervention group as compared to the reference group. The house index was reduced by 71%, Breteau by 75%, container by 83%, and pupae per container by 99%. The pupae per house was reduced by 99%. All had a 95% confidence interval in relation to control neighborhoods. Notably, the pupae per container index, which is an indicator of productivity of breeding sites, was reduced to levels unlikely to sustain transmission of arbovirus, that is, to less than 0.1 pupae per 100 containers in intervention neighborhoods. Now, many public health professionals and government officials assume that community-derived data are of questionable integrity and validity. DengueChat challenges these assumptions by empowering communities to generate their own data and facilitating analysis and interpretation regarding risk. To validate the crowdsourced data in DengueChat that residents collected, we compared the entomological indices represented in DengueChat as a percent of households positive for larva or pupa to the values obtained by professional external entomological interpretations at the rainy season baseline, 2 dry season measurements, and a final post-study rainy season measurement. These external measurements demonstrate that the community-derived entomological indices represented in DengueChat coincide with the actual house index measured by professional entomologists during equivalent time points. Thus, the data residents collected in DengueChat have both scientific significance and validity. The pilot study in Managua demonstrates that a combination of socialware and software mobilized residents to produce community crowdsourced data about arboviral disease that are scientifically valid, abundant, historically deep, and in these ways crucial for both preventative and predictive policies of arbovirus control. It enabled residents to reduce entomological indices of Aedes aegypti infestation and therefore disease risk significantly. This mobilization constitutes an important change in the agency of residents and their community organizations. So thanks for your attention, and we welcome discussion and questions.